So acne scars are a very, very troubling condition that so many people suffer from. And years ago, we used to remove skin in a very aggressive manner to try to treat acne scars. And then we went through a period where we tried very conservative treatments. They didn't have many results. We're now using RF microneedling, devices such as Intensive and Infini, in combination with PRP, platelet-rich plasma, to enhance the results of treating acne scars. There's not one-size-fits-all kind of treatment for acne scars. And one of the reasons, there's different types of acne scars. There are box scars, there are rolling scars, there are ice pick scars. And patients have different skin types. They may have light skin, they may have dark skin. With this information together, we're able to create a treatment plan that's tailored to the patient's needs specifically. One of the exciting parts of RF microneedling is the fact that it's colorblind. We can use it in all skin types safely and effectively. When we add platelet-rich plasma, or PRP, to the mix, we're actually enhancing the result even further and reducing downtime at the same time. Microneedling is a procedure that's been done for hundreds of years at this time. It's something that is done using tiny little needles smaller than the diameter of the hair. And we know that repeated injections with these needles can actually stimulate collagen and refine the skin. Radiofrequency is an energy source we've also used for many years, and that we know also helps to improve the condition, the tone of the skin, the evenness of the skin, improve fine lines and fine wrinkles. Well, technologies have now been developed that combine the radiofrequency and the microneedles. Through these tiny little needles are these probes that deliver this harmless energy source called radiofrequency. So we now have synergy where the addition of radiofrequency to the microneedling improves the result. And now, even more, we're using platelet-rich plasma, or PRP, after the RF microneedling treatment. So why are we doing that? Further synergy. We know that platelet-rich plasma also stimulates the body to produce new collagen to refine the skin even further. So with the RF energy, the microneedling, and PRP, we're able to achieve better results and actually with less downtime. The addition of platelet-rich plasma, or PRP, to the RF microneedling device is a way to enhance the result, to improve the quality of the skin even further. And this is something we do for rejuvenation, and recently for acne scars. We find that when we add the PRP to the RF microneedling treatment for acne scars, we're improving the results and actually decreasing the downtime. We know that platelets are responsible for wound healing. If someone has a cut, the platelets run to the area and they release different products called growth factors. Well, with PRP, we're actually taking those growth factors and concentrating them in an area of treatment, such as RF microneedling for acne scars. And we combine these different procedures, we're getting better results and actually less downtime, faster recovery. So it's been a tremendous discovery over the last few years. So patients are asking, well, what is platelet-rich plasma? What is PRP and why do we use it? And specifically, why do we use it in combination with laser treatments or RF microneedling? And platelet-rich plasma is actually taken from your own blood. So we're actually drawing blood just as you would for a blood test, and we're processing that blood and extracting concentrated platelets and growth factors. We then take that product and inject that back into the skin in the area we're treating. So there's different ways of using platelet-rich plasma, which essentially are the concentrated platelets and growth factors that we are able to process from someone's own blood. Well, sometimes you can do some gentle microneedling and wipe the platelet-rich plasma on the skin and hope it absorbs. The better way of doing it is actually injecting it under the skin. It's a way of enhancing the result that we're achieving with different laser treatments, and it's a way of speeding recovery at the same time. Patients are really excited by the use of PRP, or platelet-rich plasma, because it's their own product. It's safe, it's something that's derived right from their blood, and it's something that is very predictable in its outcome. When we use platelet-rich plasma, or PRP, in combination with RF microneedling, we're enhancing the result. we're improving the acne scars even further. And not only are we getting better results, the downtime or the inflammation that we see after treatment is actually less because platelets are responsible for wound healing. What I really get excited about is the fact that we have so many different procedures and technologies in our arsenal. We may use RF microneedling for acne scars. We may use a carbon dioxide laser. We may use a fractional non-ablative laser. These are all different types of technologies. And patients and colleagues ask, why do you have so many different technologies? Because there really isn't one size fits all kind of treatment for problems. We may have a patient that has light skin where they need one kind of device and someone with darker skin that needs a different kind of device. There's also different types of acne scars. There are rolling scars, there are box scar scars, there are ice pick scars where we don't even use lasers at all. We use a chemical called TCA to treat it. So when we assess our patients, we develop a treatment plan that may incorporate different types of treatments and provide them over a period of time. And the main advantage of using different technologies, as we just talked about, is safety and better result. The use of platelet-rich plasma in combination with RF microneedling is a way to enhance the result, to get further improvement than just using RF microneedling alone. It's a long-lasting change, and it's a very, very safe treatment, something we use in patients of all skin types, all times of the year, and all ages, male, female. So it's something that's become a standard of care for acne scars and something that has loads of patient satisfaction.